Some dangers are invisible. They hide in sand, soil, and even on our pets. Cutaneous and visceral larva migrans. Learn how they spread and how to stay protected.
Today, we're discussing cutaneous and visceral larva migrans, which are infections caused by animal parasite larvae, mainly from dogs and cats. Humans are accidental hosts, so the larvae cannot mature in us, but they can still migrate through tissues and cause disease. There are two main types: cutaneous larva migrans affecting the skin and visceral larva migrans affecting internal organs. CLM is caused by hookworms such as Ancylostoma brasiliensis and Ancylostoma caninum. The adult worms live in dogs and cats, and their eggs are passed in feces. In worm soil, the eggs hatch into larvae, and the infective stage is the filariform larva, which penetrates human skin, often through bare feet. VLM is caused by Toxocara canis and Toxocara cati. The eggs mature in soil, and humans get infected by ingesting contaminated food, water, or soil, especially children. Common sources include contaminated soil, sandboxes, and beaches, with risk factors like walking barefoot and poor hygiene. In CLM, larvae migrate within the skin, causing intense itching and snake-like tracks, usually on the feet and legs. Although uncomfortable, CLM is localized and self-limiting.
Visceral larva migrans causes systemic symptoms such as fever, fatigue, weight loss, and abdominal pain. Larvae can lodge in organs like the liver, lungs, brain, or eyes, causing more serious complications than CLM. Comparing CLM and VLM, CLM affects the skin and enters through skin penetration, while VLM affects internal organs and occurs through ingestion. CLM symptoms are mainly itching and skin tracks, whereas VLM causes fever and organ damage, making it potentially severe. Diagnosis of CLM is clinical, based on characteristic skin lesions and exposure history. VLM diagnosis requires blood tests showing eosinophilia, serology like ELISA for Toxocara, and imaging such as ultrasound or CT. Treatment includes antiparasitic drugs like albendazole or ivermectin for CLM and albendazole or mebendazole for VLM. Severe VLM may need corticosteroids, and specialist care is required for ocular involvement. Supportive care includes symptomatic relief and monitoring organ damage. Preventive measures include regular deworming of pets, wearing footwear outdoors, good hand hygiene, and preventing animals from defecating in public areas. In conclusion, larva migrans is preventable and treatable, and early recognition reduces complications.